was going through the internet and I saw there are a lot of YouTube videos on the exercises that can improve your thyroid function. So I am a doctor who has been taking care of patients with thyroid dysfunction for the last 14 years, and I'm an endocrinologist. I'm a certified endocrinologist. I can tell you with 100% certainty that there is no exercise which can reliably improve your thyroid function. So there are a lot of videos which says that you can do yoga, you can stretch your neck like this and the thyroid blood flow will increase and all that. So it may be good to do those exercises for your well-being in general, but typically it is not going to have any influence on your thyroid function. Okay, so you need to distinguish between snake oil and science. So there is no science behind the fact that you can actually improve thyroid function due to some maneuver or exercise. So of course exercise is good for various other things that may be associated with the thyroid dysfunction the same person. Like for example, someone is having obesity with hypothyroidism. The obesity would improve when you do exercise, like diet, exercise. If you do, that improves your weight actually, but that will not going to contribute a lot in improving the thyroid function. I'll tell you the main reason why. Majority of the thyroid dysfunction that we encounter in day-to-day clinical practice is that of autoimmune thyroid disease. There are two forms of autoimmune thyroid disease. One is Hashimoto's thyroiditis, or an inflammation of the thyroid gland. This typically causes a high TSH or a mild thyroid dysfunction or a mild hypothyroidism. Okay, so some patients among these Hashimoto's thyroiditis patients can also get frank hypothyroidism. I've made several videos regarding the same topic in the past. You can go to those videos in my channel. And another set of dysfunction is called Graves' disease, or antibody mediated hyperthyroidism or overactive thyroid. So this antibody mediated overactive thyroid is caused due to a TSH receptor antibody. In fact, we can do a blood test and measure this antibody and we can diagnose Graves' disease biochemically also, but typically we don't need a biochemical diagnosis, especially if the patient is having an eye protrusion or if they are having a skin problem called pretibial myxedema. Okay, so these are clinical clues to the fact that the patient is having Graves' hyperthyroidism. Apart from this represents almost 98 to 99% of thyroid dysfunction in our patients. Apart from this are other common sense reasons for hypothyroidism. Your thyroid gland has been removed due to surgery. So if you have thyroid cancer, your thyroid gland will be removed. And of course, you need to take lifelong thyroid hormone replacement because there is no thyroid gland that you have. Some children may be born without thyroid gland. Okay, this is called congenital hypothyroidism. So this again is an important cause. It's a very small percentage of total number of hypothyroidism patients, but it's an important cause. Here again, children are born without a thyroid gland, so they need a thyroid supplement throughout their life. Of course, no exercise is going to improve their thyroid function in such scenario. So one need to apply common sense. So can anything be done to improve this autoimmune disease, and why nothing is being done to improve the autoimmune disease? From the wellness industry, there is a lot of criticism regarding mainstream doctors saying that the thyroid doctor will only replace the thyroid function but will not do anything to improve the thyroid function itself. It's a fair point that we don't do anything to improve the thyroid function. The reason being that almost all the thyroid dysfunction is due to autoimmune disease. And what should you do to improve the autoimmune disease? You need to give an immunosuppressant. And how do you give an immunosuppressant? You can give a steroid, you can give a immune active drugs like cyclosporin or azathioprine. Many of these drugs are there. These drugs have never been tried in thyroid dysfunction because when you use any of these drugs will produce side effects. For example, if you take steroids chronically, you will have weight gain, hypertension, glaucoma, cataracts, muscle weakness, osteoporosis. The list of side effects is enormous, and it may or may not improve your thyroid function at the end of the day. Whereas if you give thyroid hormone, there is no side effect at all. So you are just replacing with a hormone which has no side effect. Okay, so this approach is the most optimal approach, and that's why the medical profession or mainstream medicine has not used any other treatment other than thyroid hormone for the last more than 100 years. The same applies to treatment of hyperthyroidism as well. For hyperthyroidism, we have well validated 3 treatments for hyperthyroidism. One treatment is basically anti-thyroid drug, or a carbimazole or a methimazole we can give. We also have something called propylthiouracil. So these drugs have been used for treating hyperthyroidism for the last 70 years or more, and these drugs are very effective in treating hyperthyroidism. Other 2 methods of treatment, one is surgery. You can surgically remove the thyroid gland and then the hyperthyroidism would improve. Another method of treating hyperthyroidism is actually radioiodine. So you give a small dose of iodine 131, and this iodine 131 is a beta emitter. It sits inside your thyroid gland, releases an electron. Each iodine 131 molecule, when it decays to its stable isotope, it will release an electron and it will damage the surrounding thyroid gland and cause lethal damage to the thyroid gland. The thyroid gland stops working. So this is a way of actually preventing the thyroid gland from, it's a way of actually doing a radioiodine thyroidectomy basically. So thyroidectomy, you surgically remove the gland, but when you give radioiodine, you actually make the thyroid gland undergo apoptosis by giving it a high dose radiation. Okay, so you may be wondering whether a high dose radiation is actually harmful. In fact, low dose radiation is actually more harmful than high dose radiation. High dose radiation will kill the thyroid gland cells completely and will not cause cancer. But if you take a low dose radiation, that is actually probably more harmful for the thyroid gland. So when it comes to thyroid gland treatment, there is absolutely no such thing as an exercise to improve the thyroid gland or any particular food that can actually improve your thyroid function. I have made a separate YouTube video on what food can improve the thyroid function. The answer is there is no food that can actually improve your thyroid function. There are no well conducted studies which show that your thyroid function could improve if you have a particular diet. What finally matters is for us to give, if you have a thyroid deficiency, we give thyroid hormone. If you have an overactive thyroid, we give anti-thyroid drugs. Thank you. I just wanted to make this point to bust the myth around exercises for thyroid dysfunction. There is no such thing. Thank you.